Hi, my name is Bernie and I will be doing my metered dose inhaler and dry powder inhaler competency today. So prior to entering into the patient's room, I'm going to sanitize my hands with 3 mLs or more for 15 seconds. But other than that, I would then wash my hands if they were dirty. Once they were dry, I would proceed to look at the patient's medical records. What I'm looking for is any information that I do need to know about the patient, and today the patient is here because of asthma. We are going to be prescribing or showing them how to use an albuterol inhaler and a Advair discus inhaler for their asthma. I am also going to show the patient how to use a spacer and the technique for using these inhalers. So I will be needing a spacer, the albuterol inhaler, and then also a Advair discus. I took it out of the box and I wrote down the date that we opened the medication and the expected expiration date, so that just in case the patient doesn't finish the medication by the expiration date, they know when it's expired. And then I'm also going to have my stethoscope, which I am going to sanitize as well. I'm also going to need some extra hand sanitizer and a pair of gloves. And I will also have my sheet to collect some information during the exam. So I'm going to sanitize my hands once again and then proceed to enter into the patient's room. Okay, go ahead and enter.
Come in.
Hello. My name is Bernadette. I'm from the respiratory department. Is it okay if I use your table?
Yes.
Okay, so I am going to be showing you how to use your metered dose inhaler of albuterol and your Advair discus inhaler. Is it okay if we proceed today?
Yes.
Okay, so since I got the patient's consent, I am now going to check for the patient's identification to make sure that it does match my records. Can I get your name and date of birth, please?
Charles Sopalasa, January 23rd, 1994.
Okay, and then can I see your wristband, please? So by asking him the date of birth and his name, I am able to check his wristband and the records, and they do match. I want to make sure that I do practice the patient's 6 rights, including the right medication, right route of administration, and the right to refuse. Today, since he already gave me consent to proceed, I am going to continue. I am also going to put on a pair of gloves. Have you used an inhaler before by any chance?
No.
No? Okay, so I'm going to show you how to today. I'm going to start by taking some vitals. Is that okay?
Yes.
Okay, so I'm going to go ahead and place this on your finger. And I'm also going to take your pulse real quick. Okay, and find it. Okay, so for your pulse, I got 40 for 30 seconds. I'm going to multiply that by 2 to get 80. So your heart rate is 80 before. Your respiratory rate, I got 9 times 2 for 30 seconds to equal a minute is 18. Okay, and then your O2 is 98. Doctor, are you having any trouble breathing at the moment?
Yes.
Yes? Okay. Then may I have you produce a cough for me, please? Okay, and then just try it. Unproductive. Okay, and now I'm going to listen to your lungs real quick. Okay. Forward. Usually I would go underneath the clothing, but in this case, I'm just gonna go on top of the clothing real quick. Okay. Just breathe normally, okay? Okay, go ahead and listen to the front. Same thing on top. Okay, and then on the sides as well. Okay. So, from listening, I did hear some bilateral wheezing. With the medications that I will be showing you how to use today, that will help with it. Let me just put this. Okay. So I'm going to first start off by showing you how to use your albuterol inhaler. So this is your albuterol inhaler. This is to help open up your airways. Okay. I just want to make sure that this is the right medication that's inside the box and that's on the box, that it's not past its expiration date. And I'm just going to put it in my hand to warm it up and shake it a little. So this is going to be your actuator. You want to always make sure that the mouthpiece is clear of anything so that you're not inhaling it as well. And this is the cover. It's for when you store it. There are some side effects of an albuterol inhaler. You're going to feel kind of jittery. You're going to feel your heart race, and you're going to kind of feel a little tremors. But I will be here to monitor during the entire time. So if there's anything that you do not like, just let me know, and then we could always alter this, okay? Okay, so once it's ready, I'm going to just place it in. And then to prime it, you're just going to press away from you like this. And then at least do it twice. You do want to prime it if you haven't used it within 1 to 2 days, if anything. You always just want to shake it up and then prime it away from you. And then when you're going to be taking this, you're going to be using it with a spacer, which is this. What a spacer does is it helps the medication get into your lungs without having any trouble coordinating you pressing the inhaler and having to coordinate it with taking a breath in. So what you want to do is make sure you take off the cover, place it into the hole right here, and with this one it will tell you if you're inhaling too fast. So what you would hear is like a whistling no. What you want to do is completely breathe out, and then whenever you're ready, hold your head up at a 45-degree angle, hold it to your mouth, press the actuator or press the canister, and once you press it, and then you're gonna hold it for at least 10 seconds, and when you breathe out slowly. Okay, and the breath in that you want to take is a very slow but steady one so that the medication does get deep within your lungs. When you place your mouth on here, you're going to place your teeth on this first groove right here, and then your lips over so that your teeth do not get any of the medication on it that could damage your teeth. And then also, after this, you always want to rinse your mouth to prevent thrush. It's a bacterial growth. You will start to realize that you get it once you start tasting like a bitter taste within your mouth. Okay? So go ahead and try it. Awesome, you did perfectly fine. When you take this, since you are going to be taking 2 puffs for 1 dose, you want to take the puff, wait a minute, and then take your next puff. Okay? Always want to store this in a cool place, never too hot. Okay, so you did awesome with this one. So when you take this, you will take it prior to taking your Advair inhaler. This is going to be a dry powder one. I'm going to go over it with you in a second. You always want to make sure you take it at least 5 minutes. Take this one 5 minutes before this one so that it gives your airways a chance to open. Also rinsing your mouth after each time you take your inhalers. Okay. So for this one, you're going to have a counter for how many doses are still left in here. This one is a powder. It's going to kind of be the same way as taking the other one, except this is going to need a swifter breath in, and this one you're going to have to hold for 10 seconds as well, and then breathe out very slowly so that you don't let any of the medication leave your airways. So what you're going to do is you're going to pull this back. There's going to be a little lever under here. You're going to press it down, and then make sure you place your teeth on top of this mouthpiece right here so that you do prevent thrush and it damaging your teeth again. And then taking the deep breath in, that's very quick so that the dry powder can get deep within your airways. And then same thing, breath out. Okay, so go ahead and try. Okay. And some side effects that you will be receiving or feeling, or you may feel with this one, is that you may get a headache or you may feel dizzy. Okay, how are you feeling? Good? Okay, how do you feel about the teaching?
That's good.
Good? Okay. So, between the two, which one do you take first? And then how many minutes do you wait?
5 minutes.
And then you take? Okay, awesome. So the albuterol is just as needed, or whenever you take prior to taking the Advair. You start feeling like you're getting a chest or tightness in your chest, and you would take the albuterol, but you want to stay away from taking it constantly. And then after taking the Advair, you always want to rinse your mouth, just like with the albuterol. Okay, so I took your vitals prior to this. I'm going to take your vitals again just to see if there's any difference in how you're feeling, okay? Okay, I'm going to listen to your chest again. I'm going to start in the back. Just to relax and just breathe normally, okay? I would normally go under the clothes, or I'm just going to go on top of your clothes. Okay, listen to the front. Okay, and then on the sides again. Okay. So your airways have cleared up, which means that the medication is working. I heard clear breath noises, which is awesome. I'm gonna make a note of that. And then can I have you cough for me? Okay, still same, dry, non-productive. Still no sputum. Okay, I'm gonna take your pulse and your respiratory reading. Okay. Let's go ahead and relax, okay? Okay. For your pulse, I got 45 times 2 for a whole minute, got 90, which is normal because of the albuterol side effects of having your heart race. Respiratory, I got 10 for 30, so it's going to be 20. And then your oxygen saturation is going to be 99, so it did improve, which is awesome. Okay, do you have any other questions for me by any chance?
No.
No? Okay. So I'm going to leave you with your medications. If you have any other questions about what we went through today or anything like that, go ahead and give us a call or ask any questions, okay? Thank you.
Thank you.
So after leaving the patient's room, I am going to let the nurse know what I found and what was helpful. And then I would also document it and then let the physician know how the patient reacted to the learning of the inhalers. And after that, I would take my gloves off. And then I would sanitize my hands again. And that will be the end of my meter dose inhaler and dry powder inhaler competency. Thank you.